Hello everyone and welcome to another session of next Saviours Essential Question Series for NEET PG 2025. You know this NEET PG is never complete without a question on fast and e-fast. We are going to talk about the indication, the pro placement and the relative questions which are likely to be kept in your examination. You know what they ask in emergency radiology is the trauma radiology where the questions are based on fast and e-fast. The stroke imaging where CT perfusion and diffusion weight MRI is basically asked. The aortic dissection and the pulmonary embolism. So today what we are going to talk about is the e-fast related questions. Now the question is a 35-year-old male is brought to the emergency department after a high-speed motor vehicle collision. Now the first thing which is provided to you is the history of probably a blunt trauma. Then the question is continued as that he is hemodynamically unstable with a blood pressure of 90 by 60 mmHg and a heart rate of 120 beats per minute. That means there is both hypotension and tachycardia present. Now, on primary survey, he has decreased breath sounds on the right side, distended neck veins, and a tracheal deviation on the left, as it is evident from the x rays. So, these are the features or these are the signs of tension pneumothorax. So, given the patient's condition, what is the next best step in evaluation and the management? So basically, when we have evaluated the patient, we have found that there is a possibility of both intra-abdominal and thoracic injuries as a potential cause for the shock. And before starting the management itself, during the resuscitation process, it is important for us to identify that where exactly the fluid or the air is present. And for that, the role of EFAST comes into play. That the extended focused assessment with sonography for trauma, that is EFAST, is a rapid bedside ultrasound protocol which is used in an emergency setting to detect the free fluid in the peritoneal, pericardial, and pleural spaces along with the identification of the pneumothorax. Now, it extends the traditional fast scan by incorporating the thoracic views for the assessment of the pneumothorax and the hemothorax, making it a crucial tool in the initial evaluation of the trauma patients. Now, eFast is non-invasive, it is rapid, that means it is completed within 2 to 5 minutes and is repeatable. So it provides immediate guidance for resuscitation and surgical decision making in critically injured patients. Next is individual questions are basically asked on where exactly the probes are required to be placed in case of EFAST. You know, there are in EFAST there is the involvement of 6 key probe placement for the evaluation of these peritoneal, pericardial, and the pleural spaces for free fluid or the air. The first one is the right upper quadrant for the identification of the fluid in the Morrison's pouch and where exactly the probe has to be placed in between the ninth and the 11th rib in mid axillary line for the purpose of detecting hemoperitoneum between the liver and the right kidney. So this is how it is being identified. If this is the liver and this is the kidney, so there in between the two there is a presence of the fluid and this is hepatorenal space with hemoperitoneum. The second probe placement is in the left upper quadrant for the identification of splenorenal recess. The probe has to be placed in the posterior axillary line in between the 7th and the ninth rib. And the purpose is again to identify the free fluid in between the spleen and the left kidneys. Next is the suprapubic or the pelvic probe, which is required for the identification of the pouch of Douglas in case of females and rectovesical space in case of males. So the purpose is to detect the free fluid in these spaces and they are identified using transverse and sagittal views. So this is how the free fluid can be identified using transverse and the sagittal, the longitudinal and the transverse views by suprapubic probes. And then finally, the subxiphoid, which is for the identification of the pericardial effusion or cardiac tamponade. The probe is placed subxiphoid, which is angled superiorly towards the heart. So these are the four probe placement, which is actually the fast. And what is extended fast is where additional probe placements are there for thoracic evaluation. You know, the two additional probe placements are for the identification of the anterior chest. And when you place the probe in the anterior chest, it is for the identification of the pneumothorax. So where the probe has to be placed in between the second and the fourth intercostal space, the mid clavicular line on both the sides. So what is the purpose? Is to identify the pneumothorax, right? So anteriorly, you know, the because when the patient is lying down supine, so obviously the air being lighter can be identified superiorly. That means anteriorly. On the other hand, the posterior chest identification is done for hemothorax, where the probe is placed in the posterolateral chest wall in between the fourth and the sixth intercostal spaces. So, in total, these are the six probe placements for the identification or for the completion of the EFAST. Now, interesting are the features related to what is being identified on the pneumothorax as a finding. You see, normally what happens that the visceral and the parietal pleura they move together with the respiration, thereby creating a characteristic sliding motion on the ultrasound. Now, what happens in the AM mode, you see the upper chest where the straight and the parallel lines are visible, so they appear like a wave, while in the lower part, which is lung parenchyma, so this grainy pattern is appearing like a centipede. So in total, it looks like a seashore, and that is why the name, that is seashore appearance or seashore sign. And so this is the normal appearance of the lung without any pneumothorax. Now, in case of pneumothorax, what happens? That the air in the pleural space separates the parietal and the visceral pleura, as a result of which this normal sliding movement is absent, thereby preventing the normal sliding movement of the lung. So, what is the M mode appearance in those cases? The entire screen shows straight parallel lines without any sandy texture below. That is why it resembles like a barcode or stratosphere. This is how it has gained its name, that is barcode sign or the stratosphere sign. On the other hand, if you look at the images of the hemothorax, then it can be easily identified where there is a atelectatic lung, that means compressed lung, and there is a presence of the fluid in between the pleura and the lung. So this is the importance of EFAS that we have talked about. If you go back to the question now, it will become much easier for us to answer this once we have understood the importance of this. Like, what is the next best step in the management? You know, if you proceed with the diagnostic peritoneal lavage, then it is used when the fast is equivocal or inconclusive in a hemodynamically unstable patient. So it is not helpful in detecting the thoracic injuries like pneumothorax, and it has to be conducted when E-fast is inconclusive. Point number two. The answer for that question you already are aware of now, that you have to perform an extended fast, because since the patient has a respiratory distress and hemodynamic instability, so E-fast can rapidly detect the pneumothorax or the hemothorax, guiding immediate management with needle decompression or chest tube insertion. Moreover, the hidden fluids in the pouches can also be identified. Now, the next option is perform an immediate laparotomy. Now, it is indicated for the penetrating trauma with peritoneal signs or massive hemoperitoneum on fast. But you know, it has to be done as a therapeutic measure, not for the diagnostic purpose. And immediate laparotomy, there are specific indications. First of all, you have to identify that what are the possible injuries that the patient is suffering from, which is diagnosed on fast. And finally, obtain a CT scan of the chest and the abdomen. Now, why not this? Because CT requires hemodynamic stability. And here in this scenario, the patient is unstable and need rapid bedside evaluation and intervention. And that is why the EFAST is the best answer for this particular question. So hope you will be able to solve every question asked in relation to this EFAST and FAST. Let's see how the questions are usually kept in your examinations. It becomes much easier now. Now, during a focused assessment with sonography for trauma, that is EFAST exam, which of the following is the most appropriate probe placement for evaluating the hepatorenal or the Morrison's pouch? That means they are asking about that where exactly the probe has to be placed. Now, if you look at the option number one, right upper quadrant with the probe placed transversely at the mid axillary line, it looks true. But if you look at the option number B, right upper quadrant with the probe placed longitudinally at the mid axillary line, which is directed cephalad, so this is the correct answer for this question. Now, in order to uh, further consolidate your answer, let's see other options. The left upper quadrant, as you know, that left upper quadrant is for the visualization for the evaluation of the splenorenal pouch. So this option is also incorrect. And suprapubic region with the probe placement longitudinally is for the evaluation of the rectovesical pouch in case of males or the pouch of Douglas in case of females. So this option is also incorrect. So option number B is the correct answer for this. Next is A 28-year-old male presents to the emergency department following a high-speed motor vehicle collision. He is tachypnic with a decreased breath sounds on the right side. Bedside extended focus assessment with sonography for e-trauma is performed. Which of the following is the ultrasound finding in most indicative of pneumothorax? And in the image itself, you can identify that here we are having a barcode sign and the question is specifically asking about it. So option B is the correct answer. Barcode, that is a stratosphere sign on M mode at the pleural interface. All the best for your future examinations. In order not to miss any update, please join our Telegram group. The link is provided to you in the description. Thank you.